Taryn, a behavior analyst, is set to present some progress graphs to the parents of a client. While presenting the graphs, Taryn explains that the client has made significant progress related to an increase in compliance behavior. The parents tell Taryn they disagree and that they've seen no change and would like to make changes to the intervention. What should Taryn do? Now, we're starting off with a lengthy question, but we're just going to attack the question, understand the information, and answer the question given. Question wants to know, what does Taryn need to do? We know that Taryn is presenting graphs that are showing progress related to the client's behavior, which is good. Parents, however, disagree and they've seen no change and want to make changes to the intervention. Now, this isn't uncommon where our data show one thing and the people in the client's lives see another. That could be good or bad depending on the change. However, Taryn has to take that seriously. Just because data show things are good doesn't mean they actually are, because in order to be effective, we've got to make meaningful change. So given this, what does Taryn need to do? A, explain to the parents that the data do not lie and that they are likely biased. Well, we're not going to explain to the parents that they are biased. Basically, all parents are going to be biased, and we just have to work around that fact. Also, data do lie very often. So we can't just blindly trust the data if we're getting reports that it may not be accurate. So A is out. B, ask the behavior technician to demonstrate data collection as the data are likely wrong. On the other hand, we're not just going to assume data are wrong because the parents say they see something else. And we're not going to put the technician on the spot accusing them of doing their job incorrectly. We can take steps before going that far. C, explain to the parents that it wouldn't make sense to change the intervention since the graph is clearly showing clear progress. Well, we were always open to changing interventions. One thing you need to be as an analyst is flexible. If our change isn't meaningful, and in order to be effective, we need meaningful change, we should never be against changing the intervention. So it's quite possible we might make a change. And then D, conduct an indirect interview with the parents regarding compliance and consider modifying the current intervention. Yes, D is clearly the right answer. We're going to interview the parents and find out what's going on, and then we'll consider making changes after we gather all necessary indirect data. D is clearly the answer, but had you stopped at A, B, or C, you would have made a mistake and easily missed the best answer choice. This is why we always read every single answer, no matter what. Alex wants her colleagues to adopt a new project management software. During her pitch, she includes statements such as, I'm fairly certain, and it might be beneficial, rather than simply saying, this will improve your efficiency. These qualifiers change how listeners interpret her confidence level and the strength of her recommendations. Which term best applies to Alex's use of fairly certain and might? Now we're looking at a verbal behavior question because we're looking at Alex's usage of words like fairly certain and might. And what is the context? Well, Alex is explaining to her colleagues this software, and she's saying, I'm fairly certain, and it might be beneficial instead of this will improve your efficiency. Now, at first glance, this is kind of tricky. But if we think about this word might, what is it doing? Well, if our primary statement is it would be beneficial, right? Or this will improve your efficiency. If she adds the word might, she's now adding that secondary statement, which is help qualifying or modifying it would be beneficial. And when we have these secondary statements, I think, it might, I'm fairly certain, what are we doing, or what kind of verbal operant are we using? A, an impure tact. An impure tact just means the verbal behavior is evoked by both an MO and a nonverbal SD. And that's not what's occurring here. B, an interverbal qualifier. Well, if you're fluent, you know an interverbal qualifier is not part of our list of terms. So B should not be an answer. C is the same thing, convergent naming. One reason fluency is so important is when you get these out of left field answer choices, you know through your practice and your study that you shouldn't even consider B or C. If you're not fluent, you might start talking yourself into things that don't even relate to what we're doing here. Convergent naming has nothing to do with that. This is a speech therapy idea. So fluency not only helps you understand the knowledge better, but it helps you avoid making mistakes like talking yourself into something like convergent naming. So that leaves us with D, and autoclitic is what we're looking for. An autoclitic is a secondary phrase or word that modifies that primary phrase or statement. So might is modifying it would be beneficial. This might is modifying how the listener is understanding what Alex is saying about the beneficial nature of this management software. Autoclitics are not that complicated. Don't overthink it. If there are additional words or phrases that are modifying an overall statement, think about it as an autoclitic. A wellness coach collects a client's daily steps for 2 weeks without intervention to see the natural pattern. Next, the coach introduces a new walking routine, noticing step count improvements. To confirm as to routine causing the changes, the coach temporarily withdraws routine, observes a drop in steps, and then reintroduces it, seeing the step counts rise again. Which concept describes using prediction, verification, and replication here? All right, so this question throws a lot of information at you, but now that we're attacking the question, how it's presented makes this very simple. Because despite all this information, the question is only asking about the concept related to using prediction, verification, and replication. And when we use prediction, verification, and replication, what concept are we using? If we look at A, internal validity, internal validity has to do with a functional relationship or functional control, where our independent variable is controlling the dependent variable. So our manipulations are controlling the behavior. B, external validity has to do with generalization outside of the study or research environment. And neither A or B is related to the use of prediction, verification, and replication. That's going to be C, baseline logic. So despite what all the information is given up here, which is related to this concept, all we need to know is what concept involves prediction, verification, and replication. It's going to be baseline logic. And then D, because we read all of the answer choices, a group comparison design. Well, baseline logic is one of the uses of single case design in ABA. So in this case, we're not using a group comparison design. This looks like some sort of single case design or single subject intervention. The concept using prediction, verification, and replication is going to be baseline logic. A behavior analyst is implementing behavior-based interventions to improve employee performance at a marketing company. During a progress meeting, the consultant describes the results using terms like stimulus control, operant extinction, and discriminative stimulus. Members of senior management look confused and begin asking clarifying questions. What should the behavior analyst do in this situation? So we're looking at a behavior analyst, and what are they doing? They are implementing behavior-based interventions at a marketing company. Now, what we're concerned with is the analyst or the consultant is using terms like stimulus control, operant extinction, and discriminative stimulus. Now, think about yourself as an analyst, and if you're doing a presentation in front of some untrained or non-behavior based people, even parents, for example, who aren't necessarily trained in behavior or aren't based in behavior analysis. If you start throwing around terms like stimulus control and discriminative stimulus, what do you think is going to happen? Well, they're going to probably get confused, and that's what happened here. Management looked confused and started to ask questions. Now, in this situation, or in situations where we have naive learners or untrained learners or people who aren't behavior analytic based, what should we do? A, answer any question asked of them and continue using these terms to expand the management's knowledge. If you're getting a ton of questions about the terms you're using, then your terms are probably too complicated. One, explaining these terms is going to slow you down. Two, it's probably going to be more confusing. And three, they probably won't retain it, and you're going to end up having to explain again and again and again. So A is not the best route. B, avoid using jargon and replace those terms with more common language. Easy as that. Don't use jargon. Use phrases and descriptions that the common person can understand. You're not trying to show how much you know or how smart you are. You're trying to educate and help. And so use language these people are going to understand. Avoid jargon. C, include jargon during the initial training so the terms are more familiar during the progress meeting. Sure, if you started off with jargon, they'd probably be more familiar with these terms, but it doesn't mean they're going to understand them and that you want to explain them any less. Avoid using jargon when possible. D, provide a glossary of terms and definitions so that management can follow along during the meetings. Could be helpful, but you really want them focusing on what you're saying. And if they're focused on what they don't understand as far as the terms go, they're going to miss your message. So, overall, as a behavior analyst, you want to try to avoid using jargon as often as possible. When you're discussing with other behavior analysts, yes, you can use more jargon, but as a general rule, you're trying to explain things with common language and as simply as possible. Which of the following answer choices is not a necessary aspect of informed consent? This came up the other day, so I thought I would re-approach this topic. When we do informed consent, these are things like intervention changes and starting treatments, or if you're doing research, you're going to need informed consent from your participants. And there are certain aspects that are necessary for someone to give informed consent. This question wants to know what is not necessary. A, the person must demonstrate capacity to decide. Yes, they have to show that they are able to decide one way or another. B, the person's decision must be voluntary. 100%. You cannot coerce them to agree. C, the person must have adequate knowledge of salient aspects of treatment. Now, this one's important. What do they mean by adequate knowledge of salient aspects of treatment? It means they don't need to know every single thing about the treatment, the ins and outs, and exactly how to run it. They just have to know what's important and what's going to be done. So if you think about D, the person must be able to read or interpret all steps of the treatment. Well, that's not necessary. It's not necessary for the person giving informed consent to know every single thing about the treatment, every bit about it, and to be able to replicate it perfectly. They just have to understand and know the most important parts of that treatment and what is expected of them. Thanks for watching. Check out behavioranalyststudy.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.